on this question of immunity if you've been vaccinated decades ago. Does it last?
So there is a very specific group that does have to worry about their immunity from vaccination. So people born after 1957, but vaccinated before 1968, that group is unlikely to have robust immunity from infection. And at that point in time, they were using less effective vaccines. So that group in particular. Now, there are other people. I myself have gotten boosted in the past because I work in healthcare, I've worked overseas, and I've worked in places where there was an active measles outbreak. So there are other groups who would also potentially benefit from a booster.
Generally speaking, do you think we should get reboosted? Because when should you get the measles vaccine?
So we typically vaccinate children. So between the ages of 12 to 15 months is your first dose. That's after the antibodies you get from your mom through the placenta and through breast milk have faded away so that the vaccine will actually work. So there's a logic to when we vaccinate. And then the second dose is given typically at about 4 to 6 years. That, for most people, will protect you for life. One dose gives you 95% vaccine effectiveness, 2 doses, 97%. It's not perfect, but it's very close.
But with this outbreak, should you get reboosted?
It really depends. So if you fall into that particular group, again, born after 1957, vaccinated before 1968, I think it could make sense for you. There are certain groups where, unfortunately, we cannot vaccinate. So people who are immunocompromised, we cannot boost you safely because it's a live vaccine.
What if you don't know? Your parents are dead. You can't remember what you did when you were an infant. I mean, you don't know if you're vaccinated.
I mean, the first step is still to try to track down those vaccination records. But if you're somebody like me who moved around a lot as a kid, that might be hard to do. There is no harm in getting an extra dose, a booster, if you're not sure. And that's actually what we would advise to do, as opposed to getting a blood test to see if there are antibodies. It's just get a booster if you're in doubt.